Look, I read the tease, Lisa, you and Sonu in there. What is it, $1.5 million for
$1.6 million
for
one shot.
Yeah.
Steve, what's $1.6 million?
Yeah.
Among friends.
Yeah.
Okay. All right.
Exactly.
But Dr. Ahluwalia, you're talking about this first ever approved gene therapy drug, one-time only shot.
Right.
What does this mean? And it's for something called the orphan disease, but it has ramifications beyond that.
Right. So, a lot of diseases that we suffer from are related to gene mutations. That means the genes somehow changed and are either not producing the right kind of proteins or hormones or things that we need enzymes to digest certain things, and that's why we have certain diseases. And these are diseases like cystic fibrosis, diseases like Parkinson's disease, even diabetes, a lot of diseases. And for the first time ever, we have government-sponsored approval to start marketing this drug.
The European Union.
This is only in Europe, but next year it's going to probably be offered to the FDA to be approved. And we've been doing this since the 1990s. You remember the bubble baby that had no immunity? We tried it in that instance and it seemed to work. So finally, I think we're at the point where even though you may be born with a bad gene, perhaps we can fix it.
Basically by giving it a good gene and to help
yeah,
it
I mean,
better.
think about it. If you didn't have a certain enzyme to digest, let's say, fat, which is this disease, and you had all these bad fats floating around your body that cause heart disease and death, instead of treating the fat and the problem, you just fix the gene, and you're a normal human being then.
So over in the European Union has done it's called the orphan disease, and it's a one-time shot that they can use there.
Right.
$1.6 million. Right. But we're looking at the implications here.
Correct, but I mean, it's not like this disease is orphan. Orphan diseases mean diseases that have such few patients that it's not financially worthwhile for companies to research it, right? So this is like 1 or 2 per million. That's not that many people. So there's not that much incentive for a company to invest millions and millions of dollars to produce that medicine. So that's why these are called orphan diseases. And often, they have to be donations or people have to be interested in helping people. So this disease is an orphan disease and they have a treatment. The only problem is the treatment is very expensive. But I mean, if you had the disease or if I had the disease, I want the treatment. And we're hopeful that this small start will eventually take us to Parkinson's, will take us to cystic fibrosis, and eventually we may get to the point like the movies where, one shot and suddenly you're cured.
You're cured and it's a little more cost effective.
Right.
Okay, next to the next thing, the whole issue of sleep, and does it make you gain weight or lose weight if you're getting enough or not enough?
Right. So they did this great study, and they had these patients who they either gave them 3 hours of sleep for 3 nights in a row or 9 hours of sleep for 3 nights in a row. And then they measured different hormones. And what they realized was that both men and women overate if they didn't sleep enough. But the difference was that the men felt hungrier and the women just weren't satiated. So they both ate a lot more, and on an average of 300 calories more each time. So that is concerning to us, and we may think that, in our grand scheme of things, when we talk about obesity, other than exercise and diet, and we may say get enough rest. So I think that's something very important.
7 to 8 hours,
yes.
right? Okay, as always, Dr. Ahluwalia, nice to see you.
Nice to see you too.
Thanks for being with us, Steve.
And by the way, I'm so glad you brought up the issue of the orphan diseases, because we know that the big pharmacy companies do things to make millions and millions and billions of dollars.
Right.
And one of the arguments they make is, well, we make those billions so that we can then put money into diseases very few people have.
Right.
Some people accept that argument, some people don't.
I know, but I think that there's enough people who try to help people with these orphan diseases that we're thankful that we have some treatment for them.
All right, thank you, Sonu Ahluwalia, and thank
Thanks,
you,
Steve.
Lisa Breckenridge.